हेलो गुड मॉर्निंग मैं से डॉक्टर आर्यन। आज हम डिस्कस करेंगे मेडिसिन के सम इम्पोर्टेंट एमसीक्यू। विच आर द फॉलोइंग कंडीशन इज नॉट टिपिकली एसोसिएटेड विद मेंडेलियन कॉज ऑफ हाइपरटेंशन? लीडर syndrome, polycystic kidney, congenital adrenal hyperplasia, and syndrome X. Here the best answer is the syndrome X, because the syndrome X also known as the what metabolic syndrome. Metabolic syndrome or insulin resistance syndrome is not typically associated with the Mendelian inheritance pattern, rather than it's a complex multifactorial condition involving genetic, lifestyle, and environmental factors, including in the secondary cause of hypertension. Secondary cause of STN, hypertension. Next question. A 25-year-old female came to the clinic with a complaint of unclear speech for 3 days. On examination, the patient had pertussis diplopia, nasal regurgitation of fluids, and oropharyngeal dysphagia. The doctor advised an idophonium test, and the result was positive. Which of the following is the treatment of choice for the generalized condition? Thymectomy, pyridoxysteroid, plasmapheresis, intravenous immunoglobulin. The best answer is the thymectomy, because here the condition described question in generally of what? Myasthenia gravis. Myasthenia gravis. And the what is the characteristics by unclear pertussis diplopia, unclear pertussis diplopia, and nasal regurgitation, nasal regurgitation of fluids, and oropharyngeal dysphagia. Idophonium test used for the diagnosis of generalized myasthenia gravis. Thymectomy is the treatment of choice for the generalized myasthenia gravis. And pyridoxysteroid is the drug of choice for symptom relief of generalized myasthenia gravis, and not the treatment of the choice. And for the plasmapheresis in myasthenic crisis patient, we will use the plasmapheresis for the patient to get rid of the dangerous antibiotics and intravenous immunoglobulin. In myasthenia crisis patient, we will use plasmapheresis for the patient of the rid of dangerous antibiotics. If facilitated the plasmapheresis is not available, then we use the intravenous immunoglobulin. Next question. Identify the type of microcytic hypochromic anemia involved a child with normal RDW, TIBC, and rest SR, and ferritin along with the merge index of 12. Iron deficiency anemia, beta thalassemia trait, anemia of chronic disease, and sideroblastic anemia. Here the best answer is the beta thalassemia trait, because the microcytic hypochromic anemia is divided into the anemic or chronic disease. Anemia of chronic disease. Thalassemia, sideroblastic, and IDA. Thalassemia, sideroblastic, and IDA. Left finding of increased SR, iron, and ferritin along with the merge index of 12. RDW and TIBC are Mentor's index 13 less than 13 helps in the diagnosis of the what? बीटा थैलेसीमिया टेट. अगर मेर्ज इंडेक्स लेस देन 30 होगा तो हम क्या डायग्नोस करेंगे? बीटा थैलेसीमिया टेट. अगर लेफ्ट फाइंडिंग में दिया है इंक्रीज एसआर हो रहा है, आयरन हो रहा है, फेरेटिन हो रहा है, अलॉन्ग विथ नॉर्मल आरटीडब्ल्यू है, टीआईबीसी आर मर्ज इंडेक्स लेस देन 30 है, तो हम डायग्नोसिस करेंगे बीटा थैलेसीमिया टेट. बीटा थैलेसीमिया टेट. नेक्स्ट क्वेश्चन. विच ऑफ द फॉलोइंग इज नॉट करेक्ट डिफरेंस Nugent's criteria? Replacement of lactobacillus dodolin bacillus by pathognomic organism like Gardnerella. Replacement of lactobacillus dodolin bacillus by pathognomic chlamydia and Bartonella and Rickettsia. The best answer is the Gardnerella, because the replacement of lactobacillus dodolin bacillus by pathogenic organism Gardnerella is a new generation replaces old generation. So this one is the best answer. Next question, which of the following disease is associated with IgG4 defect and affect the submandibular gland? Kutner syndrome, Ormond disease, Riedel thyroiditis, and Microji disease. The best answer is the Kutner syndrome, because the Kutner syndrome is associated with an IgG4 defect and affect the submandibular gland. In Ormond disease is associated with IgG4, but it causes the what? Retroperitoneal retroperitoneal fibrosis. Retroperitoneal fibrosis. Riedel thyroiditis is also is IgG4, but is involved in thyroid gland, not involved in submandibular gland. And Microji disease, IgG4 related disease affecting the salivary gland and lacrimal gland. Salivary gland and lacrimal gland. So, if we hear the 4 MCQ, if they ask Kutner syndrome affected the submandibular and Ormond disease, क्या है? Retroperitoneal fibrosis, Ormond disease, retroperitoneal fibrosis, renal thyroiditis involved in the thyroid gland, not in the submandibular. Renal thyroiditis नाम है में thyroiditis, तो क्या करेगा? thyroid gland. And Microji disease is involved in the salivary gland and lacrimal gland. Once again, the important questions, which of the following associated IgG4 in if submandibular आस्क करेगा था कुटना सिंड्रोम ऑर्मोंड अगर पूछा है तो रेट्रोपेरिटोनियल फाइब्रोसिस, रीडर थायराइटिस, थायराइड है तो थायराइड को अफेक्ट करेगा. मिक्लूज डिसीज affecting the salivary gland and lacrimal gland. Miklux disease, salivary gland and lacrimal gland. So today that's all, and thank you and keep revising.